driven healthcare system that we have, where there's a pill for every ill and a drug for every bug, to a system that really talks about how the body can work naturally and normally, and what are the really internal working mechanisms of our immune system, and how does our body work better? How does our immune system work to fight off the things that we're exposed to? Now, about 5 years ago, I was doing some volunteer work at the People City Mission Free Clinic, and I worked there for about almost 6 years for free. Every Friday afternoon, I'd see patients, and some of them have followed me over here, not many, but a few of them have. And I remember one day, I was in the room working, and somebody was out in the hall, a patient of somebody else out there, and here's what I heard him say. I heard him say, you know, I get a cold, and then I get over it, and just as I get over it, I get another one. And then it happens over and over and over. He says, I never seem to be able to stay well. And they were saying this to like one of the nurses or one of the students that was taking blood pressure. I was working on somebody at the time, but I wanted to stick my head out and say, hey, I can help you. I can help you with that, you know? Now, nevertheless, this guy's diet was pretty bad. I could tell by looking at him, and that was probably part of the issue, was the food that he was eating. But there were some other issues too that I think were going on with him that I could have really helped him with. So I want to ask you, is it normal to get sick over and over and over? To have a cold, get over it, have another one? Is that normal?
No.
No. I mean, what is normal? Stay well, yeah. Health is normal. It should be, at least. Health should be normal. But for a lot of people, it's not. So they were going to talk about the war within. Now, this talk starts out a little bit funky, but stay with me, okay?
Okay.
So, So we had a war on poverty in 1964. I don't know if you remember President Johnson declaring that, but the poverty rate is about the same as it was then, after about $6 trillion that we've spent. So that war, we haven't done too well in that war. What about the war on cancer? 1971, President Nixon declared the war on cancer. How are we doing with that? Yeah, not very well, right? Okay, the war is lost. It's, I mean, we haven't done, we just, you know, our best cancer drugs really might extend your life 3 to 6 months at the very best, okay? And that's at the cost of, you know, $10,000 to $20,000 a month. Then we have the war on drugs. How's that going? Not very well, okay? Let's talk about painkillers, okay? The opioids. Does anybody know how many people die per day from opioid overdose? Is that 100? That's a really good answer, actually. It's almost twice that. It's 192.
Across the United States?
Yeah. Across the United States, 192 people. That's the latest figures. That's the figure I got last week, actually. So think about it. If 192 people died every day in aviation accidents from commercial airlines, would anybody fly? No, nobody would fly. Let's say 192 people a day died from chiropractic care at chiropractic clinics. What do you think would happen?
You'd be out of business.
Well, we'd be lynched. Are you kidding me? They'd have lynch mobs coming to our office. I mean, I'd be out of life, you know. I wouldn't be alive, you know. Yeah, come on in, Mike. So, you know, we do have a serious. I mean, the war on drugs should actually start with opioids, and medicine is concerned about it. Not as concerned as I think they should be, but they are. And so then we had the war on terror. How's that working out? Yeah, it could be better. Okay. So we're going to talk about the war within. Our body's constant battle with pathogenic and just bacteria. Now, This is from Claude Bernard, who's a very famous French physiologist. And he debated a lot with Louis Pasteur. And he says, illnesses hover constantly above us. Their seeds blow by the wind. They do not set in the terrain unless the terrain is ready to receive them. So, what causes disease? Is it the seed or the bacteria or the viruses, or is it the soil? Is it the person? What do you guys think?
Person.
The person. Why do you say that, Mike?
Because I'm an old dairyman. Drinking whole milk has a lot of bacteria in it, and it actually, to me, makes you better. So in other words, I'll look at the milk after the seed and say that it's the soil that's bad.
Okay. So you're saying that if the person is unhealthy to begin with, they're going to get sick.
Yeah.
Okay. Anybody else? Okay. So here's the thing: is anybody grow up in a family of more than like one kid? Okay. So I had 3 siblings, and I know families that have way more than that. Okay. So do you ever notice that when one of your siblings got sick, that not necessarily all the time everybody would get it? Okay. Somebody get the flu, and the other kids wouldn't get it. Maybe one other one would get it, but not everybody get it. Yes, you're breathing the same air, eating the same food. Why is that? I mean, if it's the flu, if everybody's exposed to it, why didn't everybody get it? Okay? That's something to think about. So, are we exposed to germs all the time?
Yes.
You know, one of the things that Louis Pasteur said on his deathbed, it's the soil, not the seed. Okay, because he always said he's always arguing with Bernard that it was the soil. So let's talk about this. When you've been in the grocery store, have you ever noticed these sanitary wipes for the handles? Mm-hmm. Okay. Now I want to ask you a question. How did civilization survive without those? I mean, how many grew up without those things? When we go to the store, we just grab a cart and move on. We didn't think about that. You know, and so why do we need those? I mean, I never use them. I think it's good to be exposed to some germs because your body then learns how to fight them off. Okay? So do we strengthen the host or do we attack the disease? A report of 276 volunteers exposed to a common cold virus showed that those who had been under stress more than a month were most likely to get sick. You know, why is that? How come that happens? Yeah, and how does stress how does it lower your immune system? Anybody know? What are your stress glands? That's right, your adrenals. You've been to some of my talks and you remember. Okay, your adrenal glands. Yeah, they sit on top of your kidneys. They handle stress. What do they do? What's the main hormone that they produce?
Adrenaline.
Cortisol. That's right. Cortisol. Cortisol affects what are called the Peyer's patches of the small intestine, where most of our immune system reacts. So what happens is when the adrenal glands are stressed, there's an immune paste called the secretory IgA that lines our gut. That gets really thin, and those Peyer's patches don't work as well, and so we tend to get sick easier when we're stressed. Okay, that's why that happens. So what would be a way that we can handle stress so this doesn't happen?
Relaxation.
What?
Relaxation.
Yeah, relaxation. Okay. Right. How else?
Exercise.
Exercise. Exactly. How else?
Sleep.
Sleep. Yeah, what a concept. You know, I just had an article I got today, just pull it off today. I'm going to talk about it on my radio show, where 7 to 8 hours is the prime amount of sleep that we need to get. If you get more than that, your immune system doesn't do as well. If you get less than that, your immune system doesn't do as well. Sleep is really important. It's that 7 to 8 hour window is really, really important. And they looked at people who slept more than that, like 10, 12 hours a day. They did worse. Their health was worse. People who didn't get enough sleep, their health was worse. So sleep is really important. What else? How else can we handle stress?
Anxiety.
How can we make stress, how can we handle it better? Because stress will produce anxiety. How about eating a healthy diet, making sure that we put in the right foods, okay? So how do a lot of people handle stress?
Valium.
Valium, yeah, that's right. Yeah. That was especially true in the 70s and 80s. Well, they eat comfort food, right? Like donuts and ice cream. You know, big bowl of ice cream before you go to bed. You know, which really destroys your mitochondria. When you eat before you go to bed, that really hurts your mitochondria, the power plants of your body that give you energy. That's how people wake up with no energy. They eat a lot before they go to bed. And the mitochondria poisons the mitochondria. Anyway, that's a little off the subject. So immunity is inherited, acquired, or induced resistance to infection by a specific pathogen. That's the definition of immunity. So the immunity is as complex as our nervous system. It produces a matching antibody for every one of the there are millions of different infective agents. And it's able to remember those decades later. Now, it doesn't do this immediately. It's really your innate immune system that is the most important part of your immune system. Now, what is that? The innate immune system is a part of your immune system where if you get a scratch, and all of us have done that, you know how it gets red, swells up, might get a little pussy. That's your innate immune system. That's the white blood cells rushing into that area, causing an inflammation, not allowing any of the bacteria that got into that wound to spread and killing it off, okay? This part, about the remembering part, that comes later on, okay? Your innate immune system is way more important than what's called your humoral immune system. So immunity requires action. Although germs may be one of the essential and contributing causes, they are not alone sufficient to produce illness. That's Dennis Jaffe, PhD, who does a lot of work with nutrition and health. B.J. Palmer, the developer of chiropractic, stated if the germ disease were correct, there'd be no one living to believe it because we're always exposed to germs everywhere. So the strength of our immune system determines our body's ability to resist infection and the growth of abnormal cancerous cells. Exercise will increase the production of neurons in your brain. Alcohol, nicotine, and lack of sleep reduce the number of neurons in your brain. That's Discover Magazine, March 2009. So what does the research show regarding chiropractic care in the immune system? This is a very interesting study published in JMPT, Journal of Manipulative and Physiological Therapeutics, February 1992. You probably never heard of the study, but Patricia Brennan's a PhD, and they're wondering what happens to the immune system when somebody's adjusted. So they took some patients, and they found out that when somebody's adjusted, they get this white blood cell burst. They get this, it's called this burst of polymorphonuclear neutrophils, or there's the neutrophils increase significantly, very quickly. And that shows the relationship between the adjustment, the nervous system, and the immune system. That was published in February 1992. Probably none of you ever heard of that because you don't see these kinds of things on TV. Okay, here's a very interesting study that was done at Life University in 1994. They looked at HIV positive patients. And they had two groups of patients. One group was adjusted over a 6-month period. Patients that were adjusted had a 48% or 46% increase in the number of CD4 cells. It's a very important immune component, and CD4 is one of the things you look at in AIDS if somebody's responding well to AIDS treatment. These measurements were taken at the patient's independent medical center where they're under medical supervision. The control group, the patients that were not adjusted, did not demonstrate this dramatic increase in immune function. It actually experienced about an 8% decrease in the CD4 cells. So here is a study done in 1994, quite a while ago, and it was done in Atlanta. This is in Atlanta, Georgia, and they have a large gay population in Atlanta. They have a lot of people with AIDS there. And so they found that their CD4 cells increase with chiropractic care. Here's another study done by a man by the name of Ron Perro, and I've seen his name on several different studies, and he wanted to look at how does chiropractic care just affect the immune system. So we measured the immune system of people under chiropractic care as compared to those in the general population. It was a 3-year study of 107 individuals who've been under chiropractic care for 5 years. He says the chiropractic patients were found to have a 200% greater immune competence than the people who had not received chiropractic care. So, and this is at New York Preventative Medicine Institute, New York University. You can look up Ron Perro up online. But how does that happen? How does it happen that when somebody's adjusted, that their immune system gets better over time? Anybody? How does that work? Okay.
The nerves are gonna be open. You know what you're doing.
Well, the last thing you said about the nerves, that's the key, okay? Because here, and you've all seen this chart, this is the autonomic, you see how all the organs are connected to the spine via the nervous system. So when your spine gets worked on, that affects organ function and makes those organs function better. Now, the primary part of your nervous system is in your small intestine right here. Now, you have part in your spleen, part of it in your thymus, a part of it in your bone marrow, but 80% is in your gut. So when you get adjusted, and that affects the gut, okay, you're affecting the nervous system. Now, here's an interesting thing to think about. One of the things I've noticed over the years is that the two most common places I have to adjust people in their thoracic spine, which is your mid-back, is T8 and T10. You know, 88, probably 80% of the time, when I adjust the thoracic spine, that's what the body shows me to adjust. T8 is one of the main centers that goes to your adrenal glands, which has immune influence. Okay, T10 go to your small intestine, which is what? One of your main immune centers. Now, I don't know why I have to adjust those two places most. I think it's because, number one, people are under so much stress, you know, and the adrenal glands just need help. And number two is that our immune systems are under so much assault, number one, by what we eat, and that the chemicals that we're constantly exposed to, that those circuit breakers in the spine are tripped pretty regularly. That's what I think, okay? There may be a completely different explanation than that, and if I ever find it out, I'll let you guys know. The immune system is affected through the connections with the endocrine and autonomic nervous system. And chiropractic care improves the function of the nervous system through correcting spinal subluxations. Now, there's an interesting article in Medical Hypothesis, this is 2015, It's an article I covered on my radio show regarding spinal manipulation. It says spinal manipulation results in coactivation of both the autonomic nervous system and the endocrine system. The end product of these two systems would then be regulate inflammatory response and tissue healing. It's a pretty powerful statement. The medical hypothesis is certainly not a chiropractic journal. I mean, they have all kinds. It's the one journal that really thinks outside the box. They have a lot of really interesting and pertinent articles in that journal. Here's another really interesting study. This is in the Journal of the American Osteopathic Association, September of 2016. So this is not a chiropractic journal. A study published in 2016 looked at the effect of spinal manipulation on hospitalized patients with pneumonia. The group that received spinal manipulation had the following results: 38% reduction of days in the hospital. Now, think about this. These aren't people with back pain. These are people with pneumonia, okay? This is something that you think about, you know, for pneumonia, that's treated with antibiotics, and those are treated with drugs. But they thought, let's manipulate the spines of these patients, let's adjust them and see what happens. The mortality rate dropped by 890%, okay? Manipulative treatment reduced the in-hospital mortality rates of those with the highest severity of illness. So it was ones that were the sickest. Manipulation also reduced the length of stay and in-hospital mortality rates in older adults with more severe pneumonia. So you think, why is this being done in every hospital? You know, you see this study like this. Why isn't it being done? What do you guys think?
They don't believe in you.
Yeah, that's basic. That's the bottom line.
It really is.
Yeah, and even when you got a study like this, it still doesn't matter. Okay, so because old habits are really hard to change, and you know our culture, our medical system is so invested in the pill, the pharmaceutical method of healthcare that it's really hard for them to understand this. And it's hard for people who don't understand chiropractic to understand this. In other words, what is chiropractic mainly for in most people's eyes? Pain, right? Mm-hmm. Pain in the back, like it's like an opioid, a natural opioid, okay? One that you don't get addicted to and you don't die from, okay? It's like a natural opioid. And that really is, actually, the pain relief in chiropractic is a nice side effect of this kind of thing. You're actually engaging the autonomic nervous system, the whole body to function better, the immune system to function better. The pain relief is just really is actually a good side effect of that. So here's another interesting study. Again, Ron Perro was part of this study. They looked at DNA repair, and they looked at what happens to people with chiropractic, what's called serum thiol levels, which is a surrogate of DNA repair. What happens to that when people get adjusted? And they said comparison of thiol levels in patients with active disease, and then under 3 months and 6 months of more of chiropractic care. So serum thiol levels in patients with disease who weren't getting adjusted, 3 months of chiropractic care, less than 3 months, greater than 6 months, the thiol levels rose, which indicates that the DNA repair was improving. It was actually improving the repair of the DNA. So increase your immunity every day with chiropractic care, physical exercise and sleep, and then cognitive exercises, learning new materials, increases in nerve cells in the brain. So my question is this, is who do you know that's chronically ill and not getting better with traditional medical care? You know, maybe they need something different to really get them to be able to get better. Is it possible that chiropractic could help? You know, so think about that. And I'll just say, in my own experience, and whenever if I get under stress and I get sick, and that happens to me occasionally, I don't necessarily run over here and get my best, immune supplement, although I've got several of them, okay? I get adjusted. The first thing I want to do, I get adjusted. Dr. Adam here, who's adjusted me probably more than anybody. Have you ever had to come over to my house and adjust me?
A few times.
Yeah, a few times, okay? And I just want to get adjusted. Now, will I take some supplements? Yeah, but if I have the choice, if I'm sick, if I have the choice of taking supplements, getting adjusted, I'll take the supplements, but I want to get adjusted more than anything else because it's faster and has a quicker effect on my immune system. And I've had Adam adjust me more than once when I wasn't feeling well, and it did make a very big difference. Part of the issue, part of the things that we see in the office just drives us crazy, is that somebody calls up and they go, I'm sick, I can't come in today. And I'm going, well, wait a minute now. That's what we're here for. We're here because, we're supposed to help sick people. What are they going to do? Go to their physician? Hey, I'm sick, I need to come in today. Sometimes I want to say, well, bring a bucket, put on a diaper, and come on in, we want to adjust you. We want to get you better. And about half the time, the people come in, we'll adjust them, and they will be better. So that's all I have today. We actually finished a little early. I hope you got something out of this talk. I just want you to remember the relationship between the chiropractic, the immune system, and the nervous system. Very, very powerful relationship between the three. So thank you so much for taking time out of your life to come to